Did you know that UTIs are the second most common infectious diseases after the upper respiratory tract infections? Well, if you didn't know, don't worry. In this video, I'm taking you through what you need to know about urinary tract infections. First of all, you need to know what are UTIs. These are infections caused by bacteria when these bacteria enter the urinary tract through the external openings, which are the urethra. Bacteria come from the skin, around the perianal region, and even around the genitalia. Perhaps you may wonder which bacteria are responsible for UTIs. Escherichia coli, which is commonly known as E. coli, a gram-negative bacteria, is the most prominent in UTI infections. UTIs know no man or woman. However, if you are a woman, you may need to worry. Why? About 50% of all women, at least once in their lifetime, have a UTI infection, compared to only 12% of men's population. But why is it so? Anatomically, women are more disadvantaged when it comes to the issue of UTI. For instance, the woman urethra is closer to the rectum compared to men, and therefore bacteria can easily move from the rectum to the genitalia. Secondly, the urethra in women is short, and therefore bacteria can easily get to the urinary bladder. Now, how do you know you have UTI? One of the most common symptoms of urinary tract infections is frequent urination. Once there are bacteria in the urinary bladder, the bladder swells and you get irritated the moment you have a small amount of urine, and therefore you keep on urinating. A burning sensation while urinating is also a very common symptom of UTIs. Remember, this pain only comes at the start of urination. Any pain after urination could not be an indication of a UTI, but other infections or other diseases of the urinary bladder and the prostate gland among men. Symptom number 3 is blood urine. Bacteria eat up the urinary bladder, and therefore you may have some blood in the urine. However, blood in urine may be an indication of other diseases such as chronic cancer, especially of the prostate gland or the urinary bladder. Other possible indications of UTIs include the continued urge to urinate even with an empty bladder. Medical diagnosis of UTI. The moment you realize you have the symptoms of UTIs as mentioned above, it is good that you see your physician so that they can determine whether whatever you are feeling or you are going through is an UTI. Once your urine sample is collected, a medical laboratory professional will analyze the urine through two methods. One, macroscopic observation, and two, microscopic, whereby in the macroscopic, leukocytes may be seen through a heuristic tests, while in the microscopy, for a positive case, there will be so much parcels in the urine per HPF above normal. UTIs being bacterial infections, they are normally treated using antibiotics, especially the ceftriaxone, while your doctor may determine the most appropriate antibiotic to use for you. UTI medication must be taken carefully and as per the instructions of the physician. Otherwise, irresponsible intake of the medication may lead to some side effects which may include nausea, vomiting, and to some extent, it may lead to drug resistance of the bacteria. Therefore, kindly take the medication as per the prescription. Prevention of any disease is the most significant. Therefore, how can we prevent UTIs? Number one, all positive cases must be treated completely. Then we should encourage people to urinate immediately after sexual activity. adequate intake of water and other hydrates, avoiding douching among women, showers instead of bath will do better, and girls should be taught to do a front back wipe in the cleaning of the perianal region. Thank you very much for following the tutorial. In case you have any question about UTIs, please ask in the comment section. I welcome you to join me in the promotion of health and better lives through subscription and sharing of this information. Thank you and bye bye. See you in the next episode.